Welcome back. Now we are moving into the international arena, and before we actually start having a conversation among different organizations that are working in this arena, I would like to welcome Karl Leitner, who will tell us a bit about the experience in the health sector, because of course as social protection we might be starting some of these ideas in the dialogues, but other sectors are way more advanced, and our hope is that this presentation can again set a good foundation, help us maybe get some inspiration and further the debate in social protection as well. Karl is working as an acting director for Digital Square, and he is providing guidance predominantly on interoperability. So I hand over to you.
Thank you, everybody, for the invitation to be here. It's been my pleasure. And before I get started, I just want to say I've learned a lot today. I'm not from the social protection space. Over the last year or so, I've been starting to get involved, but this really opened up my eyes to some of the challenges that you're facing. We've faced a lot of the similar challenges in the health space, health information space. We haven't solved all of them, but hopefully what we talk about today will give you some insights and ideas of how to approach some of these problems and some of the guidance and best practices that we've developed. So start with a quiz. Does anybody know what country that is? Raise your hand, volunteer. We talked about GIS systems, so we should, I'm testing your geography. Uganda, yes, okay. So on this map of Uganda, we started, there's a massive investments in mHealth, digital health, e-health around 15 years ago. And every red dot on that map of Uganda was an mHealth project in Uganda. And you can see how many those are, right? None of those projects were coordinated. The ministry didn't even know that they were getting deployed. Implementing partners would come in, donors would come in with an idea, and the ministry had no idea what was going on. So that led to a moratorium. Sorry, it's hard to see, but basically the Ministry of Health, the DG, issued a letter, no more mHealth projects, no more e-health projects in Uganda until we get this mess sorted out and that you integrate with the National Information System, which was DHIS2. So you can imagine that this is not a problem only in Uganda. We have approximately 55 health jurisdictions in Africa, depending on how you want to count. And so this is a massive scale of a problem. It's a global problem that we need to figure out a way to address. One of the things that we do to address this is really invest and look at global goods. Look at solutions that can be adopted across multiple systems. And so from this pilot stage, this pilotitis, we identified solutions that worked well in multiple countries and multiple settings. And as a global community, and global health community, really focused our investments on that. So I just want to talk through some of the processes today on how we do that. So first of all, we had to recognize the problem. We've seen the problem. You can see that GSMA, World Health Organization, National Academy of Sciences from the US, USAID are all talking about, okay, we've got a problem with coordination and investments in global goods. We need to get together, right? So we've got a way to recognize this problem. There was the World Health Assembly that just happened. There was a huge announcement on digital health. One of the big focuses on interoperability, goods that can be scaled and reused, and finding effective and cheap solutions. So we now have our mandate on what to do. And so how do we actually do that? We have lots of different principles and guidance that we can make use of. First is the principles for digital development, which is tells us how, as implementing partners, donors, ministries, how we can look at the digital health programs that we're deploying. And we'll talk about those in just detail in a minute. As an investor, somebody that is funding a digital health program, we have digital investment principles, which will be announced formally in October. So we're not going to talk about them here, but shh. And we have global goods, which we talked about briefly, and we'll come back to in just a minute. So first of all, what are the principles for digital development? They're just guidance. If you're thinking about the digital health interventions, they're not specific to health, you can think about the interventions that you're making in country that are digital. What should you be doing? So design with the user. We've talked about this a little, it came up in some of the earlier sessions, that you really need to go to the people who are in the country working, figure out what their business processes are, work with them to design the systems to make sure the workflows work well, doing user-centered design. There's lots of buzzwords around this. There's lots of guidance on how to do this well. Understanding the existing ecosystem, just don't come in and pop down a system. You really have to understand what's the right solution. So we've talked about what are the existing databases, the existing social protection programs. Make sure you have a good understanding of what that is. Design for scale. You know, we don't start with just the pilot. You have to think about what is the national scale, what's going to be the next steps after you do your first one-year implementation. You know, what's the funding? Are the technologies you chose, are they going to be able to scale nationally? Build for sustainability, similar ideas. Be data-driven. What are the data use? What are the standards that you have for the data exchange? And analyzing the data and bring it together. So really thinking about this as you go through the project implementation lifecycle. Reuse and improve. Don't necessarily start with, oh, I'm in a new country, I should have a new system, let me just design it from scratch. There's lots out there that you can already use. Address privacy and security, it's already talked about, and be collaborative. And that's always a challenge because it's a political challenge, it's not a technical challenge, but you can do things, build in governance processes, build in platforms for communication that can encourage best practices. And so as a donor and as an investor, what are some of your responsibilities? So part of the responsibilities are outlined in the donor investment principles, which include you should collaborate, you should invest in national plans. So if there is a strategy or an architecture or framework that the ministry has already spelled out, you should adhere to that. You don't just go do your own thing. You enable sustainable investments by figuring out what are the long-term costs. You know, what happens after 5 years? What happens after 10 years? What's the business model? Think about that appropriate for the country. Obviously, track and measure your progress, and not just think about deploying the systems, but also investing in strengthening the skills within the country. And then how do you do this? What are the specific actions you can take? You can invest in the creation of a roadmap if it doesn't exist. You look at the maturity of the country, and there's a number of tools available to help assess the interoperability maturity, the infrastructural maturity, the governance maturity in a country. So take these in mind as you're choosing what interventions that you're going to make, what investments that you're going to make. What is the invest in the capacity to build of the country to manage and these implementations through project management skills, enterprise architecture, developing appropriate governance structures. Next is investing in global goods. So use tools that can be reused and have been proven to be reused, and use that rather than just going off and doing your own bespoke system. And make sure that you can set up the regional and in-country networks for knowledge exchange and peer-to-peer learning, because it's not always coming from the rich countries coming on down to say what's going to happen. There is a lot of regional networks that are there and that exist and are strong, and that we should really encourage that the taking of the lessons learned in one country and bring them to another. So first of all, I just want to ask, we're talking about global goods, but I never actually defined it. So global good, there's an economic definition of a public good. It's something that isn't diminished as you use it, and you can't prevent somebody else from using it. In the global health space, we have three sort of common types of global goods. One is a software tool that's open source that is being used in multiple countries. The second is maybe a software as a service, but that adheres to open data principles. So maybe not necessarily open source, but you can get the data in and out according to best practices. And finally, it could be not a software tool at all, but a resource, a toolkit, guidance, documentation, a data model that's freely available and under an open license that helps address some of the issues with some of the challenges in the health domain. So this is health specific, but you can imagine if you take away health from any of these definitions, you've got a good starting point for understanding what global good could be in more in the social protection space. I just want to talk a little bit more in detail about the software open source ones. We saw earlier Open IMIS, but there are others. So Open IMIS is in the social protection space, but it's also in the health insurance space, so it sort of crosses over between domains. Just want to highlight a couple of global goods here, not for the specific tool themselves, but sort of the role they play. So we obviously have sort of health-specific tools. SORMAS is for disease surveillance and response. OpenMRS, Pomni are medical record systems, so very health and clinical domain focused. But we also have things like Open Data Kit, which is a data collection tool that's open source. It's not health specific and be used across domains. So this is something that can be reused here. DHIS2 is a health service delivery indicator, but it's really not health specific, and it has been adopted to agriculture, educational settings. So it's another tool that can be used for analyzing, collecting, and viewing the service delivery or performance indicators. IRS is for human resources for health. Again, it's something that's not really health specific, but when we think about social protection and maybe a referral, knowing where the health workers are that can be referred to, what their capabilities and what health facilities they're working at, this is the type of information that's in there. So this is something that we could link to and has been deployed in a number of countries. Open LMIS is a supply chain system. So the commodities, it's not health specific. So we've been using it for the health domain, but a lot of the issues that you have, you could reuse the software for supply chain issues and the broader social protection umbrella. We also have OpenCRVS, so civil registration and vital statistics. So we've been supporting that, and there's linkages there, obviously, to health for if we have a birth in that's registered in an EMR system, we send a notification to a vital registration system. So thinking about the data workflow between these systems and how they fit all together, there's a lot of questions. How do we do this, right? Like that's a big problem. Luckily, we've been, skip that. Oh, this is all out of order. So luckily, we have an architecture to say, how do we fit these things together? It's something called OpenHIE, Open Health Information Exchange. What it is, it's not an actual software tool, but it's a community of practice where people that are in the health information space that want to share the data between the systems, they get together, identify what the problems are, prioritize the problems, and identify actual data standards for exchange. So once we've identified that, we can take it to the systems that need to interact, and we've got an architecture. It lets us swap in different tools depending on the context, and it really is a way to help think about bringing these things together. The other problem that maybe you could think about coming up from this lower left-hand corner with all these systems is knowing where they're deployed. So one of the efforts that we're doing supporting is the Digital Health Atlas, which is a WHO inventory of digital health investments that are being made at the country level, so that if you're a donor coming in, how do you know what's already been done? Right now, you don't know because there's a lack of information. Maybe you did a landscape analysis 4 years ago, it's out of date. So the Digital Health Atlas is a way to categorize and understand what the digital health interventions are, and we're going to see this going into procurement language from different donor agencies, and I think some have already gone in. So not only will we have this data, but we'll have mechanisms to keep it up to date. And just in the interest of time, I just want to close with a bit of discussion about Digital Square, the project I'm working on. Really, the focus of our project is to build the digital health infrastructure at a national scale through coordinated investments. So looking at all the donor investments that are being made, how do we bring those together so that we're not doing siloed investments, so that we can say, okay, if GIZ is interested in an area and USAID is interested in an area, can we co-invest in a specific tool that can be reused in multiple countries based on national priorities? And when we actually have these tools, we want to make sure that there's a capacity to do in the countries to know how to deploy and use these tools and manage these tools to improve health outcomes. And we have sort of a 4-pillar strategy I won't go into, again, in the interest of time, but we do co-investments, and we're sort of shaping the market, knowing that we're working in the low and middle income countries. There's a range from countries that are more on a humanitarian aid basis that won't have a lot of their own money to invest, to upper middle income countries. And from there, there's also the high income countries. We don't want to create a sort of segmented market space where, okay, here's a set of tools that only work for LMICs, and here's the upper income countries. And the way we're doing that is through this identification of standards and making sure that the standards that we have are applicable in all settings, and building the capacity so that we can bring in new market entrants, the private sector, the proprietary software, to work harmoniously with the open source solutions that we offer for the low and middle income countries. So thank you for your time, and I'll stop there.
I don't know whether there are any questions for clarification, only clarification. No, if not, then I would like to invite our international panel. I would like to invite Alistair again from DFID. I would like to invite Anush Bijanyan, who's the World Bank's Group's Practice Manager for Strategy, Operations, Knowledge, Learning and Partnerships in Social Protection and Jobs. And I would like to invite Ralf Rademacher, who is the sector's head, the head of the Sector Initiative in Social Protection at GSS. All right, Alistair, we heard that coordination, of course, is a key issue, and incentivizing coordination. So I was wondering, you talked earlier also about the opportunities. I mean, which opportunities would you highlight to those donors and other agencies that we still need to get on board to actually work jointly on integrated information management in the area of social protection?
Thank you. I mean, there are some reflections on that I knew I was going to say before there was any discussion. And then there are a couple of things that I think have arisen today that are worth commenting on. Those of you who are here right at the beginning will have heard Richard Clark on the video talking about DFID's commitment in this area. But it struck me it could quite as easily have been actually our Principal Secretary, or indeed our Secretary of State, saying that. And because there's a coalition of 2 or 3 elements that I think for DFID makes this area very important, and I think that would be part of my basis of advocacy for other agencies. One, and it was very well illustrated, I think, with that early video, is just the sheer inefficiency of a fragmented system. And it's not just inefficiency. We have a current saying of not just making sure that pounds, euros are well spent on behalf of the public, but they could not be better spent. And it's quite a good challenge, I think, because that efficiency, I think in terms of social protection, is really around protecting the most marginalized, those that are missing from those systems, etc. So the agenda is one of efficiency. It's one, I think I want to say a little bit more reflection on this later in this answer, but we are committed to technology and working in a digital world, understanding what that means. And so there's an alignment in terms of the objectives of this meeting. But then the third element is about leave no one behind. That for DFID is hugely important. I think for any international agency that is concerned with the marginalized, is concerned with issues of women's empowerment, is concerned with issues of disability, is concerned with the fragility which excludes so many from economic livelihoods, then this is an agenda to align to and communicate with. And so I think we see huge prospects around that of bringing these elements together, particularly with an emphasis on disaggregation of data and considering fragile environments. I have 2 other little reflections. That was what I knew I was going to say, if you like. But I wanted to just reflect a little bit on some of the discussion. One, and it's come up 2 or 3 times, I said in my opening remarks, and I believe it to be true, and it was tweeted, which is nice, about for DFID it's important for an area like this to be around the development challenge. That's the focus, and that the technology, we're not technology focused. I feel by the end of the day, I also want to observe what that's a caution against, which I think is a fear, but what the converse also is. So the reason we say that is there is a danger that we run away with technological fads and we ignore the 20, 30, 40 years of history we have in a particular field. So social protection is difficult, very much supporting presentations from the World Bank in terms of learning from the history of development. And so it's important that the dialogue starts there, and then we begin to think of how technological solutions can respond to that. But I thought there were another couple of presentations today which usefully said that technology, frankly, challenges our way of thinking about those problems. It frankly says maybe for 20 or 30 years we have not thought, so I still think of aggregating data as basically a big Excel spreadsheet, as a database. That's of my age, that's the way that it is. But in Pablo Suarez's presentation, which I thought was excellent, and thinking about machine learning, I began to think about the potential for alternative sources of data that are not collated in one grand thing, but using machine learning, drawing evidence from that. So that's a bit of that's the feedback in the other direction of technology and the opportunities it provides for us, helping us to rethink some challenges and to do them in a much more effective way. And then I really appreciated the interjection earlier on around security and privacy. In my notes, which my different colleagues excellently give me, the commitment is to empower and include. Now, include is really very clear from what I've already said, to include, but to empower, to feel that beneficiaries, to feel that citizens own this data is indeed hugely important. I have to say that I don't think that a fragmented data collection system is the best protection from that misuse of data. So that the word integration, which brings challenges, but I don't think that allowing systems to be parallel and duplicative is necessarily a strong protection for people's privacy and their security. So the issues that were raised there, and we've touched on them today, but I think you're absolutely right, we've not gone into them in depth, means that as we begin to develop the capacity to collate and to integrate, how do we then take very seriously conceptually, but then operationally, the challenges in terms of feeling that this is not an integrated system that excludes the citizen, but very much that the citizen is at the center of it, and indeed technological solutions to citizens holding the keys to it.
Thank you very much. Ralph, would you concur, or what do you see as the main steps forward from here then as well? I mean, in terms of working on potentially some of these challenges, that maybe some of these challenges might not be challenges if we get them right in a way.
I mean, it's a bit boring for a panel if I simply say I concur, but I do. Sorry for that. No, but I nicely put, and I absolutely agree. I mean, I think it is very useful to get conceptual clarity, because conceptual clarity, and that's exactly what we aimed at with the discussions in the morning, is allowing us to look actually at the challenges which are there. And some of the challenges, for instance, are indeed around, concepts of data security and privacy, and they were not ignored. So we actually needed to take this two-step approach of essentially saying, if we know the picture we are looking at, then we can actually also see what the shortfalls in the picture would be and how we can address them. And it's not only about the control of the citizen on the data. It is about the sensitivity of all stakeholders involved in what to build up, what to collect, and it was all in the presentations, and how to handle it. It is the situation on site, the capacity of people dealing with it, the capacity of the systems, from the technological side, but also from the policy and process side, to protect the data and to be mindful about it. And I think actually there is a lot to be done. And I would hope that one of the things is to not tackle that only, case-by-case basis, but to actually move to a more broad-based agreements between partners involved and saying, here is a very simple, be it a list of principles, as we've seen also in Carl's presentation, which essentially makes colleagues working on that mindful on aspects to look at. because it makes it simpler, and not everybody is a data security and privacy specialist, but essentially, if you have something at hand which gives you orientation, yeah, then you have orientation, and that's exactly what we're after. So I think that's on the conceptual side, one of the things which you really need to look at and really a nut to crack. Concept in itself is something which I think for the next steps, there are several layers to it, and we also flagged it in the discussions which we had before and a lot of input which we got in the consultation from the uprun for the event. There are aspects, I mean, like wrapping up a common understanding of what we are shooting at, because there are parallel efforts, and it just doesn't make much sense if we are running in different directions. You know, there's a very simple picture. You know, if everybody had the same idea we would want to run to, you know, we would all be running in that direction. It makes it very much simpler. But if we have different things in mind, we are running in 5 different directions, which essentially is really not helping either data security nor anything else. You know, it doesn't help efficiency, doesn't help impact. So that's an important part. But then we can also look more at aspects of the inclusiveness. We can look at aspects of, you know, gender aspects of making system shock responses. So we can really only then harvest with more conceptual understanding and digging into these things deeper. The link to e-payment systems and so on can harvest the benefits which we are looking at, because it won't fall from heaven if we don't get, you know, joint conceptual clarity on that. But I think that's more debate which we need, and there's more work to be done. It's not a one-day workshop, but it's, you know, maybe such a kind of thing is good to kick off some thinking and to essentially say, fine, we said we want to work further on these concepts, where do we want to join hands? And, you know, let's get certain things done, and different people agree on taking different things forward as well. A last point is I do think we will need to look also more strategically at capacity. I mean, the concept points to our limits in capacity to think everything through so far, but it's in the implementations in the various countries the same. It's a capacity of, you know, us as TA provider. It's the capacity of the partners, and the capacity, we've heard that as well, is not only national level but also local level. And sometimes in places, and I've lived in Malawi for 3 years. You know, it's an IT capacity who can maintain and run the system. Can we build up a capacity on site, or are we relying on people flying in and out, which is not very sensible nor sustainable? And how can we do that? Is it, you know, joining hands in efforts which are already on the way, like the Transform training course, and have amendments in that? Do we want to create somewhere dedicated summer schools for people where we say, it's a 4-week training for the IT nerds in the government, and we concentrate them there and actually make sure they all get common standards on certain things, and also network at the same time, because they can essentially borrow then advice from other countries, which comes to also one point which Carl made in terms of maybe we need to think about also global goods on some key elements, the aspects which, for instance, if you have certain key requirements and recurring in every country, why reinvent the wheel all the time? You know, are there at least, you know, it doesn't need to be one solution which you're sitting on, but are there, you know, several solutions where, however, apart from capacity in country, you have a second layer of support by a user community, which can also essentially, if your people fizzle out, at least, you know, give you remote support and keeping things running. So I think there are plentiful opportunities which we can also, and things which we really need to tackle and take forward.
Thank you, Ralph. Anush, would you have ideas of how to actually take this forward so that we get, let's say, more joint conceptual clarity, that there are joint efforts in terms of capacity building to avoid that also donors and international agencies are working in parallel on different processes? I mean, what would be the best vehicle for coordination? And of course, there probably we don't have to reinvent the wheel. I mean, the World Bank is already actively engaged in several coordination processes in the area of social protection. So what would be the right vehicle? I mean, could we tap into some of these processes?
Yeah, absolutely. Thank you. Let me start with the maybe a few pieces of information that some of you already hear, but some might not. So it might be worth repeating. And I actually wanted to mention that this coordination, fragmentation, and all of that has a long history. We identify that as an issue about maybe 10 years ago, first firmly started to discuss about it. And I think in 2012, under the G20 umbrella, there was a big push for this improved coordination at the international level, and several different mechanisms have been created, and some of them actually work pretty well. One of them you probably seen when you were tweeting today, the socialprotection.org platform. Yeah, it was one of the actions in the G20 action plan suggesting that such platform be created, and now it works as a virtual community of practice. So I think there are these type of vehicles where capacity building, they have a lot of learning on that platform. Yeah, it's a virtual platform, but has a lot of potential. And GIZ and BMZ are, I think, and others are generously funding it. So we're happy that it will be there as a global public good. So then there is a mechanism where we kind of want to have a more high-level policy coordination, and that is, there are two mechanisms right now in place. One is, many of you know, Social Protection Interagency Cooperation Board. Veronica here is from ILO, is a focal point for that from the ILO side, and we have focal point, but many of you know about it and participate regularly. So when we met several years ago in this board, we actually said, okay, we need more specific kind of action on what we do to actually coordinate and harmonize. First, harmonize, because the concept and definitions and indicators that we use very often vary. So there was a need to actually have a platform where we would agree on these definitions first. And so in that spirit, the interagency social protection assessment project, so to speak, was undertaken, and the idea there is to actually create a set of tools, both at the policy program and implementation level, where these tools would help governments with the international development partners to actually do some sort of self-assessment on where they stand on the things of interest. For example, give you there is a assessment tool around IDs. Yeah, so the partners agreed on a set of guidance, on a set of principles, guidance, and questions on which they can actually assess the ID system in the country. So the question is, why would you want to assess it? Because that's what is helping them to identify, A, where they stand vis-a-vis other countries, but B, what are the steps for them to undertake to actually get to where they want to get. So in that vein, we also, one of the tools in this toolkit is now under development is the integrated social information system tools. And there is a working group, and GIZ and World Bank and others are part of the working group. And I think they had a concept discussion in February in New York, and now they're in the process of drafting the same thing. Definitions, the guidance note on what matters for information system. And then they're gonna apply it in a couple of countries. And then the most important part comes. This will become an open source available tool on the socialprotection.org or on the SPIAC-B ISPA website, and anybody can use it. So there is no ownership, copyright on it, so to speak. And it will be available for everyone to use, every government, and not in, any expert. So, but the idea was exactly to bring together a repository of these processes and systems that are, we see variety of them, but and we saw many examples today, but there was any effort to systematize it and to try to bring it together so that we have a repository on different processes and systems and various countries use so that we can develop some sort of standardized way of addressing so that when somebody starts these things from scratch, they can actually have that available for them and not reinvent the wheel, but and maybe with the help of technology, even leapfrog and really develop it in 2 years, not in 20 years like other countries.
Well, that sounds exciting and also practical and feasible. I was wondering also in terms of being practical and feasible, in terms also the following steps. I mean, Alistair, you mentioned, of course, that you are not a technology-focused or maybe based organization. So, I mean, what do you think would be sort of the next steps? I mean, which are the areas that you would be more keen in maybe investing in and focusing on in the years to come as DFID?
Again, just to clarify the line, we're not we're a development agency,
yeah,
like yourselves, which means that we're open to, by all means, serve that. And I think we see technology as a hugely important area, but it's because it's responding, or it's seen as an effective response to development needs in a digital world, etc. I have to say I like the language of the building blocks that's been used. I like the framing of those boards at the side. Sometimes, just reflecting on the comments in terms of development, there's a notion of a roadmap. But what I felt today, and this is the delights and the challenges of a non-specialist in social protection coming in, is that I've been blown away, actually, by the concreteness, by the evidence of promising practice that's been displayed through some really excellent presentations today. So if the language of a sort of a roadmap, which always seems to be an aspirational thing of lots of things that need to be put in place, there's lots of the blocks, there's lots of the resource, the knowledge, I think, around this room and the communities that these people are drawn from. So I quite like this notion of building blocks, because with building blocks you put a building together that creates protection. And it's now the task of assembling these blocks together, much from which we know, or much from which we are encouraged by. I think DFID would have a particular interest in the analytics and the evidence that helps that construction, that senses that, yes, there's much promising practice. I was in a couple of discussions where a member of the subgroup that we were in enjoyed the presentation, but then said, actually, we could have presented something like that. We're doing something like that. But that's great. You know, there is that diversity of practice, there's that commonality of practice. But I think we're all saying that, I thought the presentation from Carl at the end was very helpful. We do not want to take the e-health, m-health route. We don't want to go through these decades of parallel experimentation. So I think DFID would be committed, or is committed, to enabling that construction, thinking through with other donor agencies, and indeed, from your earlier question, encouraging others to join this in terms of understanding what needs to be built on top of, what needs to be connected in terms of taking this forward. I think from our perspective, and this is again within the DNA of DFID, it's the excluded, it's those that are not caught by current measures that are particularly important to us. So I think we'd be wanting to make a contribution there to understand not just sensitivity to gender registration and disability, but again this notion of understanding how we create social protection systems in more fragile environments. I think those are very concrete areas that we would be very committed to working with colleagues, working through these different the concepts, the costs, the coordination, and I very much share with you the sense of the capacity to do this, acknowledging that there's much knowledge in the room, but we are what? 100 people, and there might be 1,000 people that we represent with capacity in this area, and clearly the demands are much broader than that. The other reflection slightly is that it does seem to me that there are some technical challenges here, working out the best way of doing things, and again a coherence in doing that. But there are also some political challenges. I'd link that to the privacy and confidentiality element of how that's managed and how that's understood. Also in terms of this bringing things together is not an apolitical process. This is a question of negotiation. And so I think DFID will be active in seeking to convene and to support both at that technical level in terms of building knowledge and capacity, but also working with colleagues at GIZ, the World Bank and others, politically mobilize this as something that can be, again, I very much appreciate it as a global public good and seen in global interest.
Mm-hmm. Well, thank you very much also for bringing back the building blocks. I like this image of maybe working on the glue to hold these building blocks together politically and maybe also technically by constructing a better evidence base. Ralph, GIZ, would GIZ be focusing on one of the blocks, rather the glue, the roof, whatever? I mean, is there anything that you see GIZ going forward with in the coming years?
Yes, not only the front garden, so really more of the house. No, I mean, we have, not only in GIZ, but also, fortunately backed by BMZ, a big interest in the digital developments and exploring the opportunities inherent to it, but actually, as I said, also not being ignorant to challenges. And I do think that actually the coordination is one important aspect to look at, and maybe one can also think cleverly where to bring it in. If we all are starting to tackle conceptual issues, which for instance for GIZ I would say we are very interested, look at a number of the conceptual issues, including for instance the privacy issues, which will require multiple steps to be taken. So it's not, looking at it and 3 months later you have a clear concept. It's actually looking at multiple aspects and trying to get clarity and wrap your head around it. Maybe as one of the pragmatic ways of having coordination already inherent in such kind of processes is, if one is to do such a study, do it with one other partner at least, if not two. And to say, can we at least, somehow join hands and have joint reviews, joint discussions and so on, which work very well for this day alone, DFID as an official co-host, the bank was very closely involved in our discussions, as you know, because university obviously has also been co-host, and we had good discussions beforehand. I think that's already helped and was a first tangible step of coordination. So maybe we can, make it a good practice to advance also conceptual agreements. So concepts one, I think we are to look at with a clarity on the lay of the land, the conceptual underpinnings, on the potential of creating more global goods. We are currently learning the management of global goods in the Open IMIS initiative, and we would be interested to see whether there is more to be, pulled and made available and just offered, for others to come in. And here again, it's something which is not, we hold it tight to us. It's the more joint hands, the merrier. And I think that's good. The beauty of getting the basics right is you can essentially also look at innovations, and that might be, the interesting sprinkles on the cake, on essentially saying, are there small places where you can push on some solutions the boundaries a bit and actually look at pieces where I think that's a clever way of doing it. And there are also, in the context of doing, coordination jointly and innovation jointly and coordinated, for instance, DFID and the French are already part of the adaptive social Sahel Adaptive Social Protection Program, where Germany will be joining, which is looking at 6 countries, and there are in that case already 4 parties working jointly in 6 countries in the Sahel, and integrated information management is already playing a role there. We have a link to fragility in some of these countries, more unfortunate than fortunate, but it is offering us an opportunity to learn at some of the topics you're keenly interested in, and so are we. So there are these opportunities where I think we need to make sure that we use them, particularly where we are together, because then we do joint pushing of boundaries, and I think that's which we would like to support.
And now, last but not least, Anush, where can you see the World Bank joining hands, and what kind of agenda would you be pushing forward?
Yeah, as you know, we already have a big agenda in our strategy, which is still, from where I see it, very valid, because our strategy is to focus on the building social protection systems, so that everybody can have an access to the social protection when they need it. And second aspect of our strategy is to build it in the countries that most need it in Africa. And you can already see that we have big achievements since our strategy came in force in 2012, because if you look at the World Bank 10 years ago, 15 years ago, it was majority of the programs were in the middle-income countries. Now, the majority of the programs are in in low-income countries. So we're going to continue push for low-income countries, but there we also are guided by the international partnerships that we're in, and one of them is the partnership for the Universal Social Protection 2030 to achieve the SDGs, and I think. As Felipe mentioned in his presentation, we in the World Bank see that the people, the citizen in not in the passport sense, but as a person, should be center of our social protection. It's for people. It's not for the system, it's not for the information, it's for people. So how we actually do it for people, somebody mentioned today that only 50% of globally, only 50% of population have access to social protection. We're not gonna make any big progress or breakthrough if we actually don't look at the other 50%. So for us, finding a way of reaching that other 50% of population is very important. So that's our ultimate objective. So we're actually thinking of what would be the new ways, the technology-based maybe ways to actually reach those 50% that currently are left behind. And majority of these 50% actually are in the informal sector or in non-standard employment, and therefore they actually don't have, for example, access to social security through their employment. So how can we use the technological advances to actually create maybe portable platform that would cover those who currently don't have access to social protection? So that's #1 priority for us, how to reach everyone that is left behind. But when we were thinking about it, we realized that it's going to be not an easy task, because the almost probably identical 50%, the same 50% don't have any IDs, and you cannot even know where they are to begin with. So for us, and gentleman Paul, I believe, who was making presentation and saying that the World Bank is in the 20th century, I would be glad to report that we actually moved to 21st century just this year. and our first project, a multi-country foundational ID project, that is in 5 countries, so ECOWAS in Africa, in West Africa, was approved this year, the ID project that would actually provide the foundational IDs in these 5 countries. They would be also interoperable within those countries, and since they have the economic sort of treaties there that's already a way of identifying these people and bringing them in. That's the idea. So you identify so you can bring them in into the social protection so they can access it. So again, the third aspect that we prioritize and would be happy to work with our partners, and by the way, in all this, we work with the partners, but is the integrated system for what? The integrated system should be for citizen-centered service delivery. So how can these integrated social protection systems actually be a platform that intermediates between citizens on one hand and the institution on the other hand to deliver these services to people seamlessly so we don't use it only for information, but we also use it for provision of services. And I think there are Chile and Turkey examples that have successfully done it, and we're learning a lot from them. And we're trying now to find new ways of helping others to make these platforms not only information, but service delivery. And then the other aspect that we have worked together in ISPA mechanism in place helped to do it, but the digitalization of the payments is still an issue in many, many countries. I think that in Tanzania, where there is this massive expansion of national social protection in terms of covering people, the cash is still carried in trucks. So I think there are many at the country level, though we know how to do it, but in many countries it's still an issue. So I think we're actually reaching out to Gates and other humanitarian agencies to learn better solution on how to improve. And there are a few examples and few places where we can cooperate. So that we actually don't have to wait for 20 years for to have a Chile-like system, but maybe use the technology to leapfrog and have the infrastructure, the connectivity is a problem, yeah? Maybe we can work through other sectors to improve the connectivity, for example. Because, look, if you look at health, education, and social protection, our largest government-provided services. And these are the least kind of digitized, if you wish. So private sector is much ahead of us. So we can maybe also partner with them to find these solutions. So yeah, I think these are the things that we prioritize. I think that very much in line with the building blocks, and we are happy to work with all of you to develop it. And maybe eventually we can actually support together an open source solution to build global public good for this integrated social information system, so that the interested governments can have open access. Instead of, I think health, I learned today, EMIS. So it was very interesting. So maybe we can build something like that for the social protection. So the governments actually avoid duplication and waste of time and resources, and have an open access. And there is also a danger where sometimes private contractors come and do it, and then you locked in the outdated software for the rest of your term or whatever. And that is something the open source platform can actually enable development partners to create this for the as an open public good. So I think we would support such an approach.
Thank you very much. One last very brief
very
comment.
It's a vote of thanks, which are going to be reinforced in terms of your hosting, just a very concrete thing that DFID would be delighted to do. If there is a sense that this meeting has achieved anything, if there is a sense that the building blocks are beginning to be constructed towards something that is valuable, then we would be delighted to host a follow-up meeting in around a year's time, if there's a sense that there's momentum to be sustained. Clearly, we do not want a meeting for a meeting's sake. But if there's a sense to which this is bringing a community together, there's an agenda, things are moving forward, then we would be very open to doing that.
I'm very much impressed because I'm not only impressed with like the very detailed presentations and concrete presentations, but also with the concrete commitments that we've been hearing. So I think that's also a bit unusual for donors, international organizations to actually make such concrete statements. I wanted to ask before we conclude if there are any concrete questions from the audience. Yes. And maybe we take the 3 hands that I was just seeing, or 4, and then we wrap up.
Yeah, thank you. I have a visionary question to you. I mean, we talk about more efficient technologies for a more paternalistic approach to just alimentation for poor people. But how can we combine this, and this would be more, for me, more social protection, to empower these people? I'm missing in all of these discussions, not just give them a little bit of money, but give them power to look after themselves, help for self-help. Wouldn't that be much more important? And how can you use your systems to realize such a vision?
Thank you. Yeah, since Ralf said he didn't want to agree and then agreed, I will try to be a little bit more provocative. Veronika Wozak from the International Labour Organization Social Protection Department, and also coordination desk of the ISPA tools. I wanted to get back to this question about integrated data systems, and I think we have to be a little bit careful here about what we actually mean when we say this. Do we really mean fully integration, or do we mean interoperability? I fully share the concern about fragmentation, and I fully agree that, yes, we need more coordination. But in a lot of instances, I think it depends on your objectives, but wouldn't ensuring interoperability of the systems be sufficient? We heard from Valentina Barca that creating these huge, massive databases also has risks and challenges in terms of, and costs. I mean, in terms of efficiency, it's not always so clear-cut, because if you have bigger databases, there's also complexities and costs to take into consideration. And a lot of the objectives, for example, ensuring that there is no unintended double dipping, ensuring that we know which household receives which benefits, you can do by interoperability. You don't need a unified database for that. And I mean, even in Europe, we see tendencies towards less democratic structures, if you want, and we just have to face the fact that in a lot of countries we're not necessarily operating under a rule of law, and where you can easily enforce data protection policies, etc., etc.
Sorry,
and
very
I
interesting points.
Share that
question, please.
Concern. And okay, let me move to my next point. That is a little bit related. So I mean, one is on this data. The second is on the proxy means tested, like social registries. I mean, do we then in this unified database also collect all this proxy means test information? Do we need these social registries? Isn't it enough to collect? I mean, there is one of the key principles is data collection limitation. Only collect the minimum of information that you need, because that also prevents data abuse. Data you haven't collected can't be abused. So what do we actually need to collect there? And for example, for a proxy means test, in a lot of countries where you have like Malawi,
Sorry.
you have, no, but can I make that just,
one last point,
you have 50%
please.
of poverty. Sometimes it looks at just looking at the household characteristics. The more dependents you have, children, number of children, disability, elderly people, it's, I mean, that very, very strongly correlates with the poverty you have. And so I don't think we universally agree that you need social registries also as part of these unified registries.
Thank you. Should we leave it at that?
I think there was one more
question. One last question.
And then
where is it? Okay. One brief question, please.
My name is Alex Schutz. I'm from the Swiss Agency for Development Cooperation. We're involved with the German colleagues in the mentioned OpenIMIS. So my takeaway from today, after I've listened to all of that, apart from the fact that I've learned, is yes, we've got a lot of innovation in that field of digital solutions, but I guess we need more novel approaches in terms of the governance. That's my main takeaway. And if I see two currents, one current is, efforts around coordination among donors. I think Carl alluded to some of the principles, and then sort of e-governance at the national level. And I think somehow these two things do not necessarily, are not interoperable. And I still see donors go once current, and the national governments have to sort out. And I think the Agenda 2030 tells us we need a different governance where we bring the countries together, and the country should be actually involved at global level already when it comes to governance and novel approaches to governing also digital solutions.
Thank you so much. We're trailing behind. Please allow us for 10 more minutes maybe. It would be great if the panel could also answer briefly.
Yeah, so I would say just a quick round of last statements, how to bridge maybe.
So I regret we don't have time to take those points on more fully. Two reflections. One, I think they're all very valid and we should feed into this discussion. The other relates a little bit to the question about interoperability compared to integration. Part of my brain wants to say, is that a 20th century conceptualization of the question rather than 21st, in terms of what those two words really mean? And I think that's, for me, the most promising area of technology in terms of getting that sense of integration, getting a sense of one system that speaks to each other, but has the protections and has the efficiencies of whatever is the most appropriate way. So I don't know if that is the way that it would work, but I think it's an absolutely right challenge to say what's the minimal amount or what is the most efficient way of putting data systems together in a way that it can operate in an integrated way and not in a fragmented way, but is one that maximally, and as we've said, empowers citizens, protects privacy.
Okay, I want actually to start with the last question, and I think it's the most important one. Actually, it was a statement. You're absolutely correct. It should come. The government should have an ownership, and both on the national level, but international. And I think they do have ownership of the SDGs at the international level. So where we have a problem that sometimes whatever discussed at the international level doesn't trickle down well on the national level. And I think we now need to, the development partners, we need to move to the sort of next step where we also work with our country offices and country staff so that it actually penetrates to the national level. That also links the ownership, brings me to Veronica's question. And there I also see that it's up to the government, it's up to the citizens of the country to decide what they do with their system. And majority of them don't start from scratch. There is something based on what you're actually building on. So if the easiest, cheapest, quickest solution is just do whatever more efficient solution is in the interoperability, let it be. But if you're building it from scratch, you may actually want to build the 21st century systems, yeah? So, and whether they do whatever PMT or social registry, maybe they don't need it, it's up to them to decide. It's not up to us to tell them what to do. So I think that's the most, my most important message is that the ownership by the country and the government and the oversight of the citizens of what they do is the most important thing in all this.
Thank you. Final words, Rolf?
Yeah, thanks for the very valid questions, all worth discussing in more detail. However, let me jump, between the questions a bit to try to attempt an answer. to some of the aspects at least. The question of integration versus interoperability often links to the question of, do you have functioning national IDs? You can more easily draw up an interoperable system if you essentially have unique identifiers across different databases. Sometimes, and that links to the question, do you need a social register? And I disagree with the statement or the perception that a social register is essentially a PMT equivalent. It's not. It's essentially, in many contexts, an approach to essentially bring potential beneficiaries into a database, equip them with a unique identifier to which you then can essentially allow the exchange of information between the other systems, which leads very elegantly to the first question, and that's exactly the ability to combine programs on households brings us beyond the pure alimentation, because we can essentially purposively combine, and that's the entire approach of graduation, economic inclusion, empowerment. You can purposively combine the support needed by households and deliver it to that household, and partly based also on information which we have out of such registers. So we're moving from the ability to give fragmented support, uncoordinated to a household, to a far better case management ability in the direction of, tell me who you are, and I can tell you or try to connect you to the right programs designed to support you in moving forward. And I think that's actually one of the main beauty of why we are talking about integrated information systems, because all of that information is currently being collected, but it's all over the place, and it's far less secure because we are not paying attention to the various pockets of information, and it's essentially hindering us to deliver more effectively and at the same time design better programs, essentially really catering far better to the need of people.
Thank you. So I think those were really nice concluding words from at least the international panel. Now over to you and to the last speaker for the final words.
All right. Thank you very much to the panel. Thanks for the active